Hey guys, welcome to Podiatry Practice Mastery. Don here. I want to talk a little bit about our Neuroma webinar that we had. It lasted about 45 minutes. We did it on a Tuesday from 6 to 6:45. That's the amount of time it took for that and the question and answer. And so a few things that went really good were that people sent questions. We had about 5 questions that were sent in prior. We did that via Calendly, and we asked them to tell us the questions. It worked well as well. Just especially there's a Dr. Feldman, my partner. He's just a little more experienced, and so what I really saw the benefit is I've asked him personally to kind of explain how he explains things. And I think when we're in the busyness of treating patients or we're trying to train a young doctor, it's kind of hard to do it because we don't know really how we explain things. I don't know if that makes sense to you, but if you're really good at explaining things, you're probably better one-on-one with patients or in a group format. And that's what I found with him. He was very, very good at kind of explaining things to the public. Whereas if I would ask one of the younger doctors for him to explain it to them so they can learn the way he does it, it's not the same. So this is a really good benefit as well if you're an older doctor or if you're training younger doctors, to get everyone together to learn how people treat things, doing it the same way. So that was something that was neat. We have Dr. Savitt, he's a younger guy, and he did a nice GIF, which is basically a video of like the neuroma popping out from between the inner space. So that was kind of a neat thing. I did a previous recording of an ultrasound-guided cortisone injection, which is kind of a neat thing. And then a lot of the questions were about shoes. So we talked about ultras, topos, and a lot of these other shoes. So those are the good things. There was we had 50 people sign up. We had 30 people show up, which is a pretty good number. Then afterwards, Calendly, they actually have a way of sending out emails afterwards. So afterwards, I'm going to send people the actual recording of it. If they want that, and I'll make a blog. I'll do that. I'll put in a blog post. Basically, I'll make a blog post with the video recording and some other information, and I'll send a link to that blog post. And then you can do the other things that I plan on doing. It's going to transcribe it, making the little ebook, re-recording it. So I'll take out some of the best of the videos of the slides and put it to my presentation. Now, one thing I've just been really making my life a lot easier are these recorded videos. So if you guys haven't tried that, and you want to use one of mine, that's fine. Just you can download it on Podiatry Practice Mastery, one of my videos. It's like, and then what you do is you just give the patients an iPad. So I start the conversation. It could be about neuromas, for example. And I'll start the conversation. I'll show them the x-ray. I'll feel the area. I'll say, you know what, Mrs. Jones, I'm going to have you watch this little 5-minute video. I leave. I said, and when you're done, you're going to open up the door. I leave, and then I've watched the video, and then I go see another patient. So it's a way to save time, and you're explaining the same thing always over and over and over again. So it's just a kind of a slick way of doing it. Feel free to try one of mine out if that works. I did that today on plantar fasciitis. They watched a 10-minute video, and then I went back in and I saw them, and I was able to spend more time with them. So, their perception is, wow, he spent an hour with me, and they were kind of doing that. And so if you're thinking about like meaningful use and documenting time, well, theoretically I was kind of spending that extra 10 minutes with them, and my staff liked it so much they were watching it themselves. So you might want to consider doing this. This is the webinar. If you haven't tried that, or if you have any questions, let me know. So that was fun. I guess the bad things. Some people had some mics open. We didn't really have a person like muting people, so there was a few things like that. But it's the more we do it, the better it's getting. That was really the only downside to it. So I will post, if you guys want, in the next that weekly update. I will include just that link. So if you want to see the podcast or the YouTube video, I'll put it up there so you guys can take a look at it. Okay, so if you want to see how it's done. Okay, thanks guys. Have a good day. Okay, bye.